Toolbox Talks, Bloodborne Pathogens and the Access of Medical Records. What are bloodborne pathogens? Bloodborne pathogens are microorganisms such as viruses or bacteria. They are present in blood and other bodily fluids, and they can cause potentially deadly diseases such as HIV or hepatitis B and C. What are the common types of bloodborne pathogens? HIV. This virus attacks the immune system and weakens it so that it cannot fight other deadly diseases. HIV causes AIDS, a disease with no known cure, although treatment is improving. The HIV virus is very fragile and will not survive outside of the human body for more than a few hours. Symptoms of the HIV infection may vary, but it can often cause weakness, fever, sore throat, nausea and headaches, diarrhea and weight loss, swollen glands, and white coating on the tongue. Hepatitis B or HBV. Hepatitis B is a common bloodborne pathogen that attacks the liver, causing inflammation. The disease may last just a few weeks, but in some cases can become chronic or long-term. Chronic infections can lead to serious conditions such as cirrhosis or liver cancer. The virus can survive outside the body for up to 7 days, so even dried blood presents a risk. The virus can be transmitted by carriers, meaning people who have no symptoms. Symptoms may vary but may cause fever, jaundice, abdominal pain, nausea, vomiting and loss of appetite, fatigue, and in rare cases, death. There is no medication available to treat hepatitis B, meaning it has no cure, though people do recover on their own and they never become infected again. The virus does have a safe, effective vaccine available that is usually given as 3 to 4 shots over a 6-month period. Hepatitis C or HCV. Hepatitis C is another common bloodborne pathogen and is similar to hepatitis B and attacks the liver. In about 3 out of 4 cases, HCV leads to a chronic infection and liver disease, which may be life-threatening. The virus can survive outside the body from 16 hours up to 4 days. As with HBV, it can be transmitted by carriers. Some symptoms for hepatitis C are similar to hepatitis B and may cause fatigue, jaundice, and abdominal pain. HCV has no cure or vaccine, though medications may suppress the virus and new treatments are showing promising results. 1/4 of those infected will recover on their own, but unlike the HBV, they can become reinfected. Generally, bloodborne pathogens are transmitted through contact with infected human blood or other bodily fluids contaminated with infected blood, such as saliva. Common routes for bloodborne pathogen entry include a splash or splatter of human blood, or OPIM, coming into contact with mucous membranes, such as eyes, nose, or mouth. Entry directly into blood or muscle tissue via an injection from a needle, or cuts from other contaminated sharps such as scalpels or broken glass, and contact with exposed broken skin. Unbroken skin forms an impervious barrier against bloodborne pathogens, but sores, cuts, scratches, abrasions, acne, blisters, or cracks can allow infected blood to enter your system. If you feel that you have been exposed to another's blood or potentially infectious material, please inform your leader immediately. Engineering controls. The most effective way to control exposure to bloodborne pathogens is to use engineering controls that reduce the exposure by removing the hazard or isolating the employee from the hazard. Examples of engineering controls include medical safety devices with engineered sharps, injury prevention features, and sharps disposal containers. Administrative controls reduce the likelihood of exposure to bloodborne pathogens through process or procedure. Some examples of precautions to take to reduce exposure would be to cover any cuts or abrasions, especially those near your hands. When a potentially infectious material is present, don't touch your face, don't touch your mouth, don't eat, don't drink, don't smoke, and don't apply cosmetics, including lip balm. Finally, follow universal precautions, which include treat all human blood or bodily fluids as if contaminated. Treat all materials with human blood or bodily fluids as if contaminated. And the fact is that you will not know if you are at risk, so always take the precautions. Cleaning up and reporting. When human blood or other human fluids are present, do the following. Barrier tape off the area, put on the required PPE, place absorbent materials on the area, pour or spray disinfectant on and around the area, allow the disinfectant to sit for the required contact time, collect the absorbent material, wipe up excess disinfectant, and place the absorbent material and disposable PPE in a biohazarded bag or biohazardous container. Hand washing is one of the most important practices used to prevent the transmission of bloodborne pathogens. Wash hands or other exposed skin thoroughly as soon as possible after an exposure incident. Wash hands after removing PPE. Use antimicrobial soap. Do not use harsh or abrasive soap, and an alcohol-based hand rub may be used if the hands are not visibly contaminated. Access to medical records. Wausau Supply Company maintains records, including medical records pertaining to their employment at the company. All medical information is maintained in a secure, confidential fashion. Examples of medical records include workers' compensation and hearing tests. All employees have the right to request copies of their medical records, and all employees may request copies of their occupational medical records by contacting Human Resources. In closing, when dealing with blood and other bodily fluids, remember the universal precautions and treat as though it were infected. Always wear the appropriate PPE when providing first aid. Know where to dispose of the contaminated materials such as gauze and clothing. And all employees have the right to request personal occupational medical information. In review, universal precautions tell us that all blood or bodily fluids should be A. Treated as though it was okay to handle without protection, or B. Treated as though it was infected with a bloodborne pathogen. B. Treat all blood or bodily fluids as though it is infected. True or false? All employees have the right to view or receive copies of their occupational medical records. True. Request your medical records by contacting Human Resources. Remember that many potential injuries or illnesses can be prevented by taking the appropriate precautions and making sure we are following the company instructions in regard to control measures around bloodborne pathogens.